Good afternoon. I'm Dr. John Vanchiere. I'm a pediatric infectious disease specialist on the faculty at LSU Medical School in Shreveport. I'm a second-generation Louisiana pediatrician. My mother's a nurse in Southwest Louisiana. But first, I'm a parent and strive to be a man of God. So I represent now the teams that work for me in Northwest Louisiana, providing vaccines and testing in our community, in our nursing homes, and many of those are nurses, paramedics, EMTs, and other support staff helping make our work successful in saving lives. My different team is working with me on a daily basis on clinical trials to understand the effectiveness of the vaccines, to get vaccines approved for our children less than age 12 as quickly as we can and as safely as we can. So my first message is really to parents in the state of Louisiana. I know that there is a lot of concern about our children going back to school wearing masks. Right now, as Dr. Cantor has said, as the governor has said, masks are the only thing that will change the course of this surge right now. Masks save lives. There is no doubt about that. They absolutely do. For parents who are concerned about their children having to wear a mask at school, you have alternatives. You can use virtual school for your children, or you can homeschool your children. But it is not safe for anyone right now in the state of Louisiana to be in a public space with non-vaccinated people without a mask on. And most importantly, our children under age 12, our school-age children, are not eligible for vaccines. They are at great risk now. This is a different pandemic than we dealt with a year ago. Let me be clear, this is a very different pandemic than we dealt with a year ago. More than 20% of new infections are occurring in children. And you've heard about the children who are in our hospitals now. They're not great numbers of children, but they are our children. We know that annually, influenza virus kills about 200 children in the United States. The COVID virus has already killed over 400 children in the United States. And while the statistics will tell you that's a 1 out of 100,000 risk that your child will die of COVID, for those 400 plus families, it's 100%. Make no bones about it. Those families are struggling now on a day-to-day basis. Children in Louisiana have died of COVID, and more, unfortunately, will die. This is not a time for politics, for fighting and threatening lawsuits about having to wear a mask. Masks save lives. And if you're a pro-life Louisiana citizen like I am, wear your mask. It's very, very simple. Dr. Cantor has talked about how our health system is stretched and 50 hospitals have asked for assistance. I can tell you I work every day with nurses and EMTs and paramedics and respiratory therapists who are stressed. They're working long hours. They're working many overtime hours, many more than they would like to work. But our vocation as healthcare providers is to save lives. There is nothing greater than that. And that's why we do what we do. That's why we are on the front lines every day. That's why we go back to work each day, to save lives. Folks who are coming for vaccines up in Northwest Louisiana are coming now tenfold more than they were a month ago. That's very good. That's very good. As the governor said, those are people who were hesitant, who waited, and have changed their minds. That's good. That will prevent the next surge from hitting us so hard so quickly. But right now, this surge can only be dampened by wearing a simple mask. And educators have asked me, how can you put faith in a mask? Because it works. The data is clear. I've been in the face of hundreds of people with COVID-19 wearing a mask just like this and not gotten COVID. Masks clearly work. Masks save lives. They prevent the transmission to other people, especially those who are more vulnerable. And I asked Dr. Cantor to put this slide back up, and he pointed out before the highest rates of new infections in those less than age 39, the 18 to 29 in the gray line, and the orange line up there right between those is less than 18 age group. And that right there is the number you should focus on as a parent. We're seeing more pediatric infections now than we have at any time in this pandemic. The great news is most of those are mild. Most of those are a nuisance. Many of them start as, I think my kid's having an allergy attack or something else. That's okay. But we know that kids now are infectious, and we know that they are continuing as part of an unvaccinated population to foster the spread of this pandemic. And the only way to change that is masks. And the other piece I wanted to point out, if you look at the lowest rate of new infections on this graph, the brownish color that's at the bottom here, that's the age group over 70. That's the population in our state that's nearly 90% vaccinated. That's amazing. That's a testament to how effective our vaccines are at saving lives, preventing hospitalizations, and hopefully slowing down this pandemic. We know now that the average age of hospitalized people in our state is 25 years younger than it was a year ago. In Northwest Louisiana, we have pregnant women in the hospital on ventilators or on lung bypass because they're so sick with COVID. We've had a baby in our hospital born with COVID to a mom who had minimal symptoms of COVID. The baby was born premature, most likely because of COVID. This is a different pandemic. It is not the time for threatening lawsuits. It is not the time to mince words about where we are and the situation we're in. And I laud the governor, our public health officials. They're working tirelessly. They don't need to be berated in social media. They don't need to be attacked. Our only goal is the safety of the citizens of Louisiana. That is paramount. We are a pro-life state. There is nothing more pro-life now than wearing a mask. So please, mask up, roll up your sleeves, get your vaccines. And the last thing I'll tell you is that 25% of those who are coming out for vaccines in Northwest Louisiana are less than age 18. Our teenagers get it. They understand. They want vaccine even when their parents may not. They get it. So let's pay attention to the needs of our children. Put their safety first. Have them wear masks. It is absolutely the right thing to do at this point. So I'm happy to answer any questions that I can. Yes, sir.
With schools opening this week and next week, are you worried about a further increase, especially with these terrible numbers in children? Do you see schools closing even?
Right. The question is about the safety of opening schools and whether that presents a threat to, further fuel this surge we're in. I've talked with many of our educators, and they're working very hard to balance two things: the education of our children and the safety of our children. And those are the top two priorities. We were very, very successful last year at having our kids in school very safely and keeping them at least not from falling as far behind as many, many millions of kids across the country have. So my reality is that, yes, there will be some bumps in the road. There will be some schools that may have to close. But the mitigation strategies that we have, simple as they are very effective at keeping our kids safe. And our kids need that education. They need that consistency. School is the best place for them right now. Thank you, Governor.